Hi, and welcome to Policy Unpacked, a podcast by Global Policy Network. And in this series, we dive into the policies shaping our world, from healthcare to sustainability to education. And we explore how these critical areas intersect to drive meaningful change. Whether you're a policymaker, a practitioner, or just policy curious, we're glad you're here. Let's unpack policy together. So, my name is Amina Sachi. I'm the founder and CEO of Global Policy Network. And in this episode of Policy Unpacked, we're joined by Yousaf Ahmad, who is the Chief Pharmacist and Director of Medicines Optimization at Frimley Integrated Care System. So, Yousaf is a national leader in pharmacy and integrated care, and he brings a wealth of experience and insights to the table today. So together we're going to explore how the digital revolution, the AI and genomics is transforming the future of health and care delivery. So hi Yusuf, how are you today?
I'm very well, thank you. Thank you very much for having me on the podcast.
It's a pleasure to have you. So we're going to dive into a few questions now. So you've had an incredible journey through pharmacy, clinical leadership, and now system level transformation. Can you take us back a bit? What first drew you to pharmacy and how did this evolve into a passion for integrated care?
Um, I think I fell into pharmacy not by accident, but by serendipitous pathways. So I think I've always been interested in science. I've always been fascinated how things work. But equally, I think culturally, I've always been um, empowered to educate myself. So I think pharmacy came through by means of looking at what was out there for me. It would have been some sort of engineering, medical, pharmacy degree that I would be interested in. That's where my core skills lie. But I remember choosing pharmacy through a conversation I had with the pharmacy dean of the school that was in my city. So I studied at the University of Strathclyde, and through that conversation, kind of led me into choosing pharmacy. And I think I went to pharmacy. I went to university quite early, so I was just 16 at the time. So leaving school probably a year too early, I think. But I think that baptism of fire of going into university, starting to become more independent in terms of um, life as well as learning, for me kind of helped me to come of age quicker. And I remember quite astutely my first year of university um, was one of the hardest years because my peers had a bit more time in general schooling, probably covered some of these topics that we had, the science topics that I missed out on. So I remember that being quite a prominent part of my experience in first year of university. But I guess it chimed into perhaps some of the real focus areas of me, science, but also people. And I didn't know it at the time that my fascination of patients and people started to grow as I began university. And I think that initial sort of experience of being with different people, learning about science, particularly in relation to medicines, but also interactions with patients in the first year or two of my undergrad year started to really bring together some of the key components that really shaped me as a professional in certainly my early years. And I think that for me, I always go back to is that the reasons why we have a passion later in life is around the influences in early life. And I remember quite astutely that the School of Pharmacy that I attended, there was a real strong focus on bringing different professionals together. So they started to really bring other like nurses and medics into doing classes together with pharmacy, but also bringing patients really into the forefront quite early on. And I remember some of my OSCEs that I had participated in as an undergrad. There was a real emphasis at translating your science knowledge into the realms of what the public and patient need. And again, that was really an underpinning that it's not only your knowledge base that's important, but how you communicate that knowledge base into a manner which resonates with the public and the patient. And again, formulating and structuring some of my thinking around that really shaped me as a professional going into, particularly in my first few years as a as a pharmacist. And I also think that for me is quite important. My growing up and my where I've come from. So being a Scot and being grown up in Glasgow, um, there's some ethics and around how we are with each other. We are friendly people. We are very personable, and more importantly, I think that we're grounded to really resonate with each other. And I think that also played a strong part into where I am today, is around understanding that whatever we do has to meet the needs of the populations that we serve. So I think that, along with being, in a course that chimes with my intellectual desires around science and around chemistry, my upbringing really focuses also on making it a reality for people on the ground. And that match for me has been a real focal point in everything that I've done. And that this realization has only come later on in life. I guess when I reflect back to who I am today, it's really those upbringing, my family upbringing, the environment that was brought up in my undergrad, and the focus on science and the public early on in undergrad really helped me to understand the why question. What is it that I want to do, and what drives me? And again, that has formulated through the 20 odd years I've been working in the pharmacy profession. What my why? What is it that I want to do, and why is that? And I'm sure we'll come on to that. But in essence, that sort of focal point of my initial learning has really enabled me to focus on some of the work that I do just now.
Thank you. And tell us more about the why and what really, inspires you, drives you, and has led you to go into a leadership role within the ICS.
Yeah. Um, I, I think my whole leadership journey didn't really start until the end of my first probably 8, 9 years of my career. I think when I first graduated, and I was always I became a pharmacist that was traditionally quite hardworking, like many people are, but also wanted to just experience everything. So I remember having, working in a hospital, and at the weekends working community pharmacy, spending my evenings learning and developing myself. So I was like a sponge in terms of the world of pharmacy in the first 8 years or so, I would say, and I think that's right. There's a lot out there to know, and there was a lot out there to experience, and I just wanted to experience all of it. So I love that part, really. To become a technical expert in the world of pharmacy was most of my initial journey, and I think that also helps to ground you as an individual. So my experiences in hospital, working in different specialties, my experience of being line managed by different people, the good and bad points around what that means, my ability to see the different ends of patient care. So, caring for a patient in the hospital is very different to caring for them in a community pharmacy, and is very different to caring for them in other sectors as well. What does that all mean? And also, how do we join the dots? And I remember quite clearly there was so many occurrences where I was in the hospital and I was given advice that would also help the patient when they leave the hospital because of my experience in the community, and vice versa as well. So I think that ability to experience different sides of pharmacy, the ability to work in different sectors, and the ability to also increase my own knowledge doing, the relevant postgrads and prescribing qualifications, they all added into getting a very, very strong grounding of pharmacy in the broadest sense. And I think that in the first eight odd years, that was for me only driver in my professional kind of world is around getting the most out of every experience. Through that time, as I mentioned, you do also get experience of what uh, being managed as well as managing individuals actually means.
Mm.
And I have come across my own sort of experience of good and bad management, and I've equally grown as an individual, managing one person to managing a handful of people, and I think that shapes an individual. And
Mm.
I guess my leadership journey really started from when I experienced bad management, because it made me feel certain things, particularly around how I want to treat others, because I knew what treating me badly meant to me. But also, I believe that you could do things differently.
Mm.
There's not one way to slice both in terms of your pharmacy profession and what your career looks like, but also how you take responsibility for others.
Mm.
So I started sort of my leadership journey probably at year 8, 9, and that started through reading literature and books around leadership. And one of the things in if you were to Google leadership, there's millions, if not hundreds of millions of books around leadership and the and the theoretical as well as the practical implications of leadership. But one of the ones that really resonated with me was Simon Sinek's book around Leaders Eat Last, as well as the number of books he's written throughout his career. And one of the books also focuses on understanding what your why was.
Mm.
And it resonated with me because it focused on the altruism of leadership, the service aspect of leadership, the aspects of leadership that it requires you to understand that you're responsible for others and you have a duty of care. And I think that resonated with me because of my upbringing, because of my value base, because of who I am, probably, and who I've come of age of. Is I believed in the importance of being responsible for others and caring for others. So that leadership sort of trait that Simon Sinek talks about really honed in on me. And I went down that rabbit hole of servitude leadership. And I went down the rabbit hole of understanding a person's why. And I think that for me was where I transformed into understanding what management was to what leadership is. And I guess when I found my why, that ultimately um, refocused everything in my life. And I'm sure you're going to ask me what my why is, and I'll let you ask me. But it's important that people, that individuals, leaders who, and I'm sure many people talk about this uh, a multitude of time, you really need to know who you are in order to know what type of individual you are professionally and personally. And I didn't really do enough of that until probably year 8, 9, 10 of my professional career. Who am I? What do I stand for? Professionally and personally, what my values are, actually articulating them, writing them down, not just through psychometric testing, but through coaching and mentoring and through a guided process. And I think it's important that you are guided through that process, understanding your individual self, and then guided and mentored through the process of understanding your why. And I think those things are an important journey for any leader, and certainly for a leader that's changing in from becoming a real technical expert in pharmacy to moving into a space of leadership, management, executive responsibility. And quite often, as healthcare professionals, particularly, we don't have that type of development journey. We sort of fall into leadership place in roles. We sort of fall into executive managerial type of roles, and we learn through good and bad experiences of what leadership is. So I
Mm.
think I was really blessed to at the point to kind of find a leadership quality and pathway that resonated with me, but also be supported by individual coaches as well as some real exceptional colleagues that I was surrounded by that encouraged me to really find myself in that leadership space. And I'll end on this before we go to any other questions. The most profound thing I can tell you about my own leadership journey is once I found my why and once I understood what type of leader I was, both my well-being but also my professional career accelerated exponentially. I couldn't, I remember in that first 8, 9 years, I was really working hard and becoming a good pharmacist. And in order to transfer into that sort of leadership sort of role, they required a different pathway. And I think that different pathway started with me really being very clear in my shop front. Who was I as Yousaf as a pharmacist and Yousaf as a pharmacy leader? And what did I have to offer? And what was my value base? I didn't realize it at the time, but that's very important. People that are in at that time that were in real leadership roles recognize that. And I couldn't recognize it myself as I just understood it. But because I started to live and breathe it, other people that had gone on their own journey, who are more experienced, who understood the importance of all the things that I've just mentioned, recognized it. And that then accelerated my career, both in the pharmacy world and outside of the pharmacy world.
And Yusuf, was there a moment or a person that triggered you to look into yourself to uncover your why?
I think it was a combination of things. I think it's definitely a person. So that experience of what bad management was, how it made me feel, how it impacted my well-being, how it impacted my job at the time, and how I didn't want to feel that way. So I think there was something about that prompting it. There's also something about being surrounded by exceptional pharmacy leaders. So although I was experiencing at the time real bad management, I was also surrounded by real exceptional pharmacy professionals who exceptional in a way that they represented the pharmacy profession in a way that allowed the pharmacy profession to be recognized, to be respected, um, and I always learn better by seeing and experiencing rather than being book smart. And so there was one or two leaders at the time that I was like really in awe of, which helped me again to focus in what I wanted to try to achieve as a leader. And one of the things they commonly said was, well, who are you? What are your values? What do you stand for? What are your ethics? These sort of questions at the time of my career, I couldn't answer, you know. And you speak to colleagues in their early careers, and you tell them what values are, and some of them just don't know, and I didn't know. So it also helped me to explore myself in that. And then I had a coach again through guidance through those exceptional pharmacy leaders I was exposed to. They all had mentorship or coaching to some degree, and I decided to take advantage of some coaching that was offered by the department I was in. And again, one of the things that really shaped me was getting insight into leadership by people that traditionally didn't work in pharmacy. And that's fascinating. Fascinating to hear a different viewpoint. And again, at that time of my career, I didn't realize it. I realize it now that I really enjoy listening to folk that perhaps are not in my world day to day. And I think there's a real power in that, getting exposure in any form to different viewpoints, particularly those that don't work in your industry. So it's also helped me to kind of get my own thoughts together. And again, the coaching session, those individual pharmacy exceptional leaders, and the individual that for me was a bad manager. All of those things and kind of rolled into me finding myself, finding what professional I was, but also finding my why. And obviously, Simon Sinek's kind of etiology of books also helped me to guide through that. So I think it was probably a number of things. I don't think it was one individual thing. And also it's I always say today, even today, I'm still a student of leadership. I'm still a student of learning. And I think you'll always be that, because there's always the next thinking or the next evolution of your thinking. And I think true leaders are always that student, will always have that student type of mindset. And I think the world of pharmacy today for me, really requires an entire different way of leadership than that of old. You know, that hierarchical leadership that existed, especially when I worked in hospitals, but also in the community. I think the hierarchical leadership model is not only in decline, it's probably counterintuitive to what we need to do for the healthcare of the future, you know, and for the pharmacy professional of the future. And certainly are more resonating in recognizing people that are like-minded. You know, they say find your tribe.
Mm.
I'm finding my tribe with other pharmacy professionals, and we are trying to change the narrative of old pharmacy into new pharmacy.
And thinking about the pharmacy of the future, if you could redesign the pharmacy education, what would you make essential for future pharmacists to have to study?
Yeah. So as you know, I'm part of the General Pharmaceutical Council, and and we recently, well, not recently, a handful of years ago, changed the initial education and training standards for undergrads, where we focused on adding in prescribing, which in by 2026 we will have the first cohort prescribers coming out, which is massive. But we also added in things that looked at developing leadership skills. And I think the pharmacy program of the future, needs to take that iteration of where we are and develop it further. I think we need to be more focused on understanding healthcare in the widest sense. How do we train our pharmacy professionals to understand health better? How do we further hone the skills of leadership and autonomous thinking? How do we do that beyond just the academic part, which is important, but how do we help them to be more troubleshooters, problem solvers, more thinkers rather than academic thinkers? And the other aspect I'd really strongly and maybe bring on even further is how do we work more multi and interdisciplinary? How do we work with other professionals? How do we work with our professionals within pharmacy and outside pharmacy? So we need to build those skill sets that are beyond the scientific, which are important, but look at the human side of pharmacy. And I always talk about that being a technical expert is very important. Being a human expert is just as important. And it's not just patients, it's other professionals, it's other members of the population. So those are things I certainly think we have to build on in the pharmacy of the future and further iterations. The final thing I would add on to this is that I think we need to also think about, and this goes into some of the NHS policy aspects, is what are we expecting pharmacy professionals of the future to do? I think we have an idea of it. I think we have certainly conceptualized what we want the pharmacist of the future and the pharmacy technician of the future to do. But I think we need to be a bit broader than that. And we need to be a bit more courageous. So people talk about pharmacogenomics, they talk about AI, they also talk about advanced skill sets, being more autonomous in terms of managing caseloads, all very important. How do we build that into the undergrad? That's a question. But the pharmacist in 20 years' time, which planning has to happen now, what do we expect them to do? And I guess, that's a question that's still open-ended. I can describe what we want them to do in 5, 6, 7 years' time, but I still need to look at 20 years' time and 30 years' time and understand what we want pharmacists to do. I haven't landed on that, but I think that's the right conversation to have, and then how do we work backwards and re-engineer that? And that's a question that I pose to many of my colleagues and peers, is that what is the pharmacist at 2050 doing?
Mm.
And how do we equip the undergrad program today to do that and be ready for that?
Absolutely. And with kind of pharmacogenomics, artificial intelligence, and the digital revolution, how do we ensure that we're empowering pharmacists and not overwhelming them?
Yeah. Um, Pharmacists work and pharmacy technicians work extremely hard in all sectors. You walk into any hospital department or any community pharmacy, you'll see them, constantly on the go throughout their working day. One of the things that we need to do is trying to harness what genomics and AI can do to offload the day job of today. We need to manifest that, we need to describe that, and we need to showcase that. So, are there tasks today where AI could do? Is that ordering? Is that in relation to the dispensing part of the process? Is that in relation to prioritizing which patients that they see on the ward? I think it's all of that. So there's something about creating that capacity in the pharmacy workforce of today, utilizing particularly AI in that. The second part to that is also around understanding what we intend to do with genomics. I'm surrounded by real professionals in this space. And one of the things that they say to me is about being using pharmacogenomics to help us make better prescribing decisions. And I agree with that. And I believe in the future, we're not going to have, say, formularies that we stick to. We're going to have genetic panel testing for patients, and we'll have a clearer understanding of which medicines that a particular patient will get the best outcome and value from. So it's about making the genomics part a reality, but also making it cost effective. So currently, genomic and panel testing, the cost of it is, as the years go on, does come down, but we
Mhm.
haven't made it both universal and we haven't made it um, applicable to all yet. So the capacity of lab testing, the panel currently only having, say, I think the most I've seen is 100 odd drugs. We need genomics need to evolve, and then we need to evolve in terms of making it integrated into our decision making. Again, that for me also is a great role for pharmacists of the future. So using AI to increase their capacity and using then genomics to help them influence the health of our nation through appropriate medicine choices, I think are all examples of how these two technologies can really galvanize the pharmacy professional. But we're closer to it than we ever before. That's great,
Mhm.
but we need to make sure that in the immediate 0 to 5 years, we make this a reality.
Absolutely. And Yusuf, there's a lot of focus and discussion on neighbourhood working in integrated care. Can you explain what this means practically for medicines optimization and local pharmacy teams?
Yeah. So in a lot of the policy documents, in the model ICD blueprint, in the upcoming 10-year plan, as well as
Mhm.
some of the reflections from the Darcy report and some of the other wider NHS policies, there's a real notion to focusing on neighbourhood working. And that means, for me anyway, the the ability to bring all stakeholders together in a particular population. And people have defined neighborhoods in the region of, say, 30, 40, 50,000 people. That's kind of the number in terms of neighborhoods. And again, we'll see what that um, manifests to. But in reality, a proportion of the population, bringing all stakeholders together and actually devising a plan that's suitable for that population. I think the term integrated neighbourhood teams, again, which is very more synonymous with how things have evolved, is, I think, some of the immediate future that we're going to see in the NHS. The question still remains around how that definition can manifest into reality. So, is it all providers? Is it just health providers? Is it pharmacy professionals? Is it those working in PCN? Is it those working in hospitals? Is it those working in community pharmacy? Is it in relation to just general practice? Do dentistry or optometry come into that? So those are some of the questions that have yet to be defined. My personal take is that it's all of that. It's anyone that's caring for that population, be it in any sector or any professional, anyone responsible for caring for that particular population, being involved in the pathway conversation, decision making conversation. And if you think about it, that is the right thing, isn't it? You know, what are people really wanting? You know, what is your individual area that you live? What are you really wanting? You want to be able to get a GP appointment. You want to be able to get a dentist appointment when you need to. You want to be able to go into hospital and be cared for in a timely manner. And you want everybody to talk to each other that are caring for you. And I always think about the mum test. What would my mum want? And my mother would probably want those simple things. Why can't the pharmacist talk to the general practitioner? Why can't I go to the dentist and they know which medicines I'm on, for example? And why can't I go to the optician and they are concerned about my blood pressure because of my glaucoma, and they see the results of my blood pressure from my general practice? They would seem very simple, don't they? I think integrated neighborhood teams is the essence of that. The ability to make the IT work, the ability to have that universal health record, and the ability for healthcare professionals to seamlessly talk to each other and care for that patient effectively. And that also chimes in quite strongly to the value question. You know, the fiscal element of the NHS is publicized in every newspaper and every article going at the moment. You know, the public sector finances are not in a good state. So we need to also chime into neighbourhood working in a way of increasing the value the NHS delivers from a fiscal aspect. And I think this is right. The more efficient touch points, the more efficient healthcare that's delivered. So nobody's. I don't think we've all cracked it. There's examples of good integrated neighbourhood health, but I don't think as a country we've cracked it yet.
And there's a lot more to do. And Yousaf, you're an advisor at Global Policy Network, and we're so proud to have you. What excites you about GPN's mission and vision, and what got you involved?
Um, that's exciting to be involved in, and I think one of the things that really struck out to me is that there's a space to influence policy here. There's a space to provide real practical examples of good work to policymakers and governments across the land and across the world. And what really excites me about GPN is the ability to bring people together, to create a narrative that shows excellence, and then use that narrative to influence change. And I think that is what really gets me going, and also um, is my passion, which I share with GPN. So I think this, for me, there's a real opportunity here, especially in the time of change, which we recognise is in a time of pivot, to make sure that the work that colleagues do and the work that really changes the health of our nation has been spotlighted and has been articulated and then communicated. And I think what GPN can really do, and the people that they have as advisors, like myself, are really championing that narrative. And that narrative is going to really, I think, for me, shape some of the thinking going forward.
And you're chairing one of our medicines roundtables on the 25th of June. It's part of our UK focused roundtable series, and we're going to have some global medicines roundtables as well as part of this series. Your roundtable is on the role of medicines in the 10-year plan. So, what excites you most about this topic, and why should healthcare leaders from the public and the private sector join the conversation?
Yeah. So the 10-year plan itself would be quite a seminal document. I think we all have an idea what will be in it, and certainly we will all have an idea of where the areas of improvement, and Lord Darcy's initial report gives us that. But the 10-year plan itself will still have, I think, a lot of over to you. It will say to, say, pharmacy professionals, this is what we want to achieve. Now over to you in terms of delivering that. And I think that will resonate throughout the 10-year plan, really giving autonomy to providers and healthcare professionals like myself to shape the journey of good health for our populations. And what the roundtable will do, will start to tease out those practical innovations and examples, as well as suggest areas of work which chime into the deliverables of the 10-year plan. So the 10-year plan will talk about integrated neighborhood teams. The roundtable will go into what does that look like and what should it be. It will also go into looking at what does the digital transformation of the future look like. Again, something that will be prominently discussed in the roundtable. And also, what does the left shift mean? How do we focus on preventative health? How do we focus on community health? Again, this is a great opportunity in the roundtable to really showcase some examples of wider health areas of work that chime into this, but also the role of pharmacy within this. And I think for me, the roundtable will present some real practical evolution of what the 10-year plan should look like in terms of practical terms going forward. So I would encourage all participants that are interested in medicines, that are interested in prescribing, but also that are interested in making a change in light of the 10-year plan to get involved. And I think all voices should be heard here. And that's one of the things I like to champion, all voices, those that are associated with the world of pharmacy and medicines, and those that are affiliated in any guise, whether it's from different sectors or from different parts of the health system.
And you've been working very closely with one of the GPM fellows, Leslie, who is part of our first cohort of our fellowship program. Why is early career mentorship and policy expertise important to ambitious individuals?
Um, yes, Leslie's been fantastic. And I think it's a great initiative that we have fellows working in it. And like I described, early year development can have a profound impact on one's career, but also a profound impact on the journey of one's career. And like I've experienced, it's vitally important to have a good guide through those early years in your career, but also very important to help develop your own understanding of who you are. So again, one of the reasons why I'm involved in GPN is that working with individuals that are early in their career, shaping and exposing them to different experiences, especially in policy, but shaping their thinking will really mean that the future professionals that we are surrounded by will have those values and ways of work that really help us to transform the type of work that we do. So I think it's vitally important. I'm encouraged, I'm excited by working with fellows in their early career, but also I think it's for me, a duty to help shape their minds and thinking.
Absolutely. And what can listeners expect from you and your work at GPN?
I think what they can expect is transparency and honesty. I think they can also expect challenge. I think it's important that we provide an opportunity to showcase the good and bad of policy direction of the future. I think that's important. Challenge is very important. I also think I prefer an open door to the conversation. The more voices that we are able to hear, the more ability that we're able to get to the right answer. So you'll hear from me a range of voices and you a range of stakeholders, and equally an opportunity to shape the narrative of the future. And that's why I think that we need to champion not only a GPN, but any of the work that we produce. This is a broad church of professionals, broad church of opinions, but here are some of the common recommendations that will come out of that. And a bit of fun as well. You know, we need
Yeah,
to a bit of fun as we go through this journey. So a bit of openness and transparency and a bit of fun.
thank you. And when you're thinking about the healthcare sector, if you could change one thing tomorrow about the healthcare system, what would it be?
It's a good question. What would it be? I would say it would be um, taking out the words of "we cannot do that." I think we
And
need a more aspirational in looking at new and different ways of delivering healthcare. So I would like to take out that legacy mindset of this is how it's been done in the past, or we can't do this for X, Y, and reason. I would love to for us to just
mm,
pilot things, try things. If it doesn't work, stop it. You know, any leadership book that you read will ask you to fail and fail again, but fail fast,
yeah,
fail fast. So that's what I would change.
fantastic. And tell me about someone, whether it's a real person who you know or just a public figure that has inspired you.
Um, a couple of people. So I think in my career, as I talked about, Simon Sinek's books of leadership has really inspired me, has really transformed my thinking of leadership. And I would implore you, anyone listening to this, to go out and read it. Leaders eat, why leaders eat last, but also you're finding your why. Early in my career, and I think it's also still stayed with me to now, improvement methodology really changed my career. So the Institute of Healthcare Improvement, which was led by Don Berwick, was quite fundamental in my perception and understanding of healthcare. So that had a profound impact. So anyone in quality QI or any improvement work will probably say very similar things. But I would implore you to read up about the Institute of Healthcare Improvement and some of the thinking, particularly around Don Berwick's thinking around how to improve healthcare. That will really transform your thinking. And the last thing that I would say is um, my parents and my family and my
Mhm.
loved ones. And they give you a reason why you do things, but also you want to improve their lives through health. So I always go back to, as I mentioned, what would my mother and father want for their health? They're elderly, they have multiple comorbidities, they're on a number of medicines. What would benefit their life when it comes to good healthcare? And that I always go back to those principles when I make decisions about health. What would be easy for them, and hopefully it means what would be easy for others.
And Yousaf, if you weren't doing the current job that you're doing, what would you be doing?
That's interesting. I think I would be a teacher. Somebody asked me that. I would be a chemistry teacher, I think. My chemistry teacher in school made a profound impact on me. I love to teach. I love to expand people's minds. I love to shape their thinking. So I think I would have been a chemistry teacher. Or I think I would have been a painter. I'm left handed. And I think my paintings, well, if I draw, I just call it abstract because I'm a terrible drawer. But I'm sure I can find my niche somewhere. So a painter or a teacher.
Fantastic. And what does the future for a chief pharmacist look like? So if we're thinking about in 10 years' time, how would you see that role evolving and changing?
Um, well, there's there's some regulatory and very clear guidelines out there of what a chief pharmacist is. So the General Pharmaceutical Council in the recent years have produced a guideline of what they expect chief pharmacists to do. So on paper, at least there's some tangible and clear guide rails of what a chief pharmacist should do. I personally, and that's right, and I agree with that, and I was involved heavily in the production of that. So I think there's some clarity around my role as a chief pharmacist in the immediate future. I think um, looking ahead 10 years, I think the chief pharmacist role will solely focus on leading a profession. So leading the profession in your part of the world, not managing, not operating, but leading the profession, being a figurehead for yours. In the 20 years ahead, I think, it wouldn't surprise me that chief pharmacists that develop the leadership skills, that understand health more widely, why can't they become chief execs of the future? There's a number of pharmacists that are chief execs today. So I think, a pharmacist professional that not only has the insights of understanding health, that has a very person and population um, grounding, why can't they be leaders of health systems of the future? So I think we'll start to see even more pharmacy professionals, chief pharmacists, leading health organizations in the future.
And who would you like to see on this podcast?
I would love. There's a good few people that I can think of that I'd love to see on the podcast. I would say I would love to hear from fellow colleagues. So I'd love to hear other chief pharmacists here and what their opinion is. I'd love to hear also from non-pharmacy professionals. What do they perceive as pharmacists? So transformational directors, chief execs, chief medical officers, chief nursing officers. I would like to really hear their opinion of where they see pharmacy of the future going. I also would love to hear more around how we could influence policy and government. What else could GPN do? What else could I do to influence governments of the future? What do they need? So, ministers through to people working in the policy space, hear from them. And lastly, I think we always need to hear more from our patients, our populations. How do they experience health? How do they experience pharmacy services? What can we do to change that to make it better for them?
Thank you so much, Yousaf. And, it's been such a pleasure to speak with you, and we hope to have you back again soon on this podcast. So join us again for our next episode where we're going to be talking to Shilpa Shah, who's the CEO of Northeast London LPC. And also follow us on LinkedIn, Facebook, and Instagram, where you can find caption versions of this recording on YouTube. So thank you, Yousaf, and goodbye, everyone.
Thank you.
How did you find that, Yousaf? I've just blown.